In the midst of an ongoing mental health crisis nationwide, especially among kids, the Children's Agenda, a locally based nonprofit, is looking for solutions.
Natalie Kutchko has more now on a new poll from that group.
Tiana Johnson is a local parent advocate and has 3 children of her own. Over time, she says her family has struggled with a response to these needs.
We're dealing with things that are just not being supported, and it can leave scars on families that not everyone is able to bounce back from.
The Children's Agenda has found 2 out of 5 parents say their child has struggled with their mental health since returning to the classroom, and only 1 out of 4 parents say their child is receiving some form of emotional or mental health counseling. As the governor has earmarked $1 billion toward mental health initiatives in this year's state budget, local leaders say more needs to be done.
The way that you can address it is by getting our policymakers to release the funding and to change the laws that need to change to allow access in every single school building to mental health supports.
Sarah Taylor is the founder behind BIPOC Peak, a program led by parents and caregivers who are receiving mental health care or in need of it. Taylor says her family has also been faced with obstacles in getting timely mental health treatment.
Those of us that have sat in psychiatric emergency rooms for 10 to 24 hours a day, only being told to go home, it's behavioral. Those of us that have been on waiting lists for 6 weeks to 6 months.
Last month, we reported an upcoming expansion within URMC to triple the size of its psychiatric emergency department and create a mental health urgent care facility. Children's Agenda CEO Larry Mark says expansion is one of the community's current positives.
The good news is that there's huge support for expanding services. That's how the road to recovery begins, is we need to expand every modality of mental health and emotional supports in every place that we possibly can.